Hi, we are Group 9 and today we will be talking about Marriott hotel chains during COVID-19. Next slide, please. Since the COVID-19 virus has spread around the world without us knowing what to expect, many local stores, companies, and multinationals have run out of business. Traveling to other countries have been temporarily banned. Although the virus is still going on, the authorization to travel is allowed, but with some restrictions. As you return to your home country or wherever you call home, you're required to quarantine for 14 days. Some countries in Europe and the Middle East will not allow you to quarantine at home. Instead, they will escort you to your own hotel room and check on your health. But most of the hotels in other countries have shut down. Now, the most Now with most of the hospitals being overcrowded and hotels being closed, the solution would be to reopen some hotels to allow more room. Giuseppe will now explain the Ishikawa diagram.
Thank you. In our case, the Ishikawa diagram has the aim of showing the causes that made the Marriott Hotel Company be drastically affected by the current pandemic, and that therefore brought us to give you this solution. To do so, we're gonna show the 8M solving approach, in which we will take a closer look at 8 major categories that might be the causes of this issue. Firstly, the price was the biggest factor. Our customers were not willing to pay the same price as in the past anymore. Secondly, another major factor was the promotion process. There was not enough liquidity to go ahead with the promotion process, making it impossible to create advertisement to attract customers. The third major factor was people, both customers and employees. Everyone during that time was facing insecurity in carrying on a normal life, and therefore preferred not to go in crowded places such as hotels. Next factors was the process, meaning that we did not manage to adapt fast enough to be able to be a step ahead of the virus. This happened due to the inefficiency of all the scientific approaches given by the governments. Another factor was definitely the place. It is important to state that during this year, tourism was nearly none, meaning that it was impossible for customers to reach our destination. Next, we have the product factor. Security during COVID-19 was impossible to provide, and hotels were not able to maintain social distancing and to prove the minimum quality of their security. Procedures were also another major factors. As a matter of fact, there were no pre-existing procedures that would have helped in those situations. Lastly, another fundamental factor was the lack of efficient policies, both from central government and from various organizations. All of them gave different and insufficient interventions, making not clear the path for a solid response. Now, Julie will go ahead.
Okay, so two creative problem-solving techniques will be applied to find a solution for the issue being addressed. The first problem-solving technique that will be used is the means and analysis. For the issue presented, the main goal is to change the hotel structure and create safer procedures due to COVID-19. Each action that is being taken connects with the next one. This creates a connected chain of actions. It is very important to go step by step to ultimately achieve the final goal. The second problem-solving technique that will be used is brainstorming. By the use of this technique, the design will come up with a variety of ideas and questions to address the issue and find possible solutions. These ideas might also be connected to each other. This process is used in the ideation stage and it helps design teams expand in many directions. The more ideas are produced, the better, because that lets the team explore less conventional approaches. There are some recommendations for brainstorming to be successful. Some of them are refrain from criticism and do not judge other people's ideas, focus on the target, produce a high quantity of ideas, use diagrams, and set a time limit. Next slide, please. The implementation method that will be used is the waterfall model, that it's a linear project management approach. In this model, the necessities and requirements of the stakeholders and customers are gathered at the beginning and the project adjusts and looks to meet those requirements. The waterfall methodology has 7 stages: feasibility, plan, design, build, test, production, and support. In this case, the main goal is to change the hotel structure. For the first section, it is important to understand the different requirements that the problem presents. Some might be changing prices, implementing security measures, implementing social distance, implementing new safer procedures. For the plan phase, there has to exist a logical design. This means that possible solutions need to be brainstormed and theorized. In this case, all the administration team of the hotel needs to meet and come up with possible solutions. For the design phase, there has to exist a physical design, meaning that the theoretical ideas from the plan become concrete specifications. For the building phase, all of the theorized ideas and also the concrete specifications need to be built up and become more tangible. For the test phase, all of those requirements need to be taken in account in order to produce an actual code. For the production phase, the completed product is released to the stakeholders and customers, and it needs to meet all of their requirements. Finally, for the support phase, the product needs to be under maintenance and improving all of the time. The production team needs to correct errors during the production of the product. Now, Pedro will talk about the solution.
Our solution then would be to convert a large quantity of our unused hotels into COVID shelters, our clinics and prevention centers. Each different hotel would have a different purpose. One of the first purposes would be a 14-day quarantine location, just like they're doing in the Middle East, where we can partnership with governments when for people arriving from different countries or families less fortunate, they can go to the hotels and quarantine and have food service. Another use for the hotels are testing centers where there will be nasal PCR tests. And then if worse comes to worse, we can use our convention center rooms and conference rooms as emergency shelters and clinics where there will be set up beds and there will be a makeshift hospital. While researching this, I found a study by the King County Department of Community and Human Services where they actually tried this and they got various people from homeless shelters and brought them into hotels as a test. And it was very successful in many ways. First, it was very successful to prevent the spread of the virus in the county in comparison to other counties in the state. And there were also great positive social effects where these people, after they stayed in the hotel, all reported being better mental and physically healthy. Um, this shows us that converting the hotels into COVID-19 camps is effective at reducing the spread of the virus and it has various also positive social effects. This means that any government, any company would easily adhere to our project because there are no negative downsides to it. Please, Daniel.
So our philosopher of choice was Aristotle, due to his three key beliefs mentioned below, beginning with bad things happening to good people. The example would be Marriott hotels. Due to the unpredictability of the COVID-19 pandemic, they had no way to prepare for this. Secondly, different pattern towards development. Due to this new method being implemented, it's something that has never been used before or tried before. So by doing so, Marriott can get back into business. And lastly, logic and observations. Yet again, by observing the results of this new method, they can create an outcome that can be used for multiple hotel chains and ultimately bring back their business. I will now pass it back to Pedro with the conclusion.
Finally, after following this report, not only Marriott hotels, but any chain can effectively help with the pandemic. By following the means and analysis, any hotel can create a large goal, such as changing the hotel structure to safely protect their staff and guests. Then, the next step is to brainstorm ideas to get it to a solution. Then, our solution is to convert our unused hotels into COVID clinics and quarantine centers, which this also has the positive social effects, which I mentioned earlier, which then leads to our philosopher of choice, Aristotle, which believes that every human has their own development pace and methods. With all of this, we hope to create an effective plan that any hotel chain or government can follow to help with the pandemic.